September is World Alzheimer's and Dementia Awareness Month, and at Scarlet Homecare, we wanted to spread awareness about this disease. So I spoke with some nurses on our team to talk about their experiences with dementia.
Well, it's affected me at a personal level and a professional level. A lot of my nursing experience has been with people who have cognitive deficits, mainly, types of dementia. And I've got close family members who have dementia.
My nan had dementia and she was a bit funny. We'd be like, oh, what was for breakfast this morning? Or like, how was your morning? And she goes, I don't know, been asleep since then. It was like her catchphrase. I think I started learning about it then. And then I was a carer. So I used to get put in the dementia ward a lot. They would just say the funniest things. So I grew close to quite a few patients.
I haven't had any loved one in my family having dementia, but I have spent a lot of time with patients. The first memory I had with a patient with dementia was when I was doing my placement in a residential aged care facility in the sort of dementia side of the residents. They asked me to sit down with a resident who had dementia and spend some time with them. I played Scrabbles with them, the Scrabble game. So I made up a word like hello, and the resident made another word. She wouldn't spell the word right, but she knew how it sounded. So for example, enough, she would spell it ENAF. She would try to think what it was, and I would try to correct it. Like I would help her spell it correctly, ENOUGH. And like I did that a couple of times, corrected her, but then I saw she was a little distressed. She was apologetic. She was like, oh, I'm so sorry. I don't know why I can't remember and stuff like that. And now that I reflect on it, I'm like, I could have not corrected her and just spent time with her and asked her about that word and trying to jog her memory and stuff like that. She had some good time with me, but then when I reflect on it, I could have done better.
I had a patient and she would not like ADLs. Like she would have a lot of difficulties and get quite aggressive. And so we used to sing this song. It was like that, hey, good looking, what you got cooking? And so she would only let us do care if we were singing that song. So we would literally just be like, hey, good looking, like cleaning her and showering her. And she was so beautiful. And so I think I found like an interest. I was like, I love these behaviors because I can like work with this. They have no filter. They are like so flamboyant. So I was like, I like this. So, and you see them going from like not getting personal care or not getting the help they need or really struggling and not coming out of their room or not getting out of bed. And then I think it's really cool because I get to find like an extra way, like a colourful way of trying to help them get up for the day.
It's a terrible state. It affects holistically as a family, as a person. It takes your identity away from a person. You don't know who you are. Your whole life has been wiped out. And it's a major responsibility for the family, I would say.
It can be quite undignified, particularly for relatives and friends of that person, and obviously for that person if they have insight into what they're lacking.
I had this lady, she came into our dementia ward when I was doing aged care as a nurse, and she like wouldn't have a shower, and she'd come out to the door and she'd go, nurse, help me. And you'd come down and I'd be like, what's up? She goes, I didn't call you. And I was like, I'm the nurse, what can I do? We worked with her for so long. I got like a visual board up, we got a routine set, we would, work with a lot of the behaviours, and we had this whole routine up that about 3 or 4 months later, she was sitting out and eating breakfast every morning at the table with everyone. And we even got her going on bus trips. She was so beautiful. Like she was lovely. And she like would have her little sweets and she'd be like, I just can't do it. I can't do it today. And then we'd be like, yeah, you can, come on. And yeah, it was just really nice seeing the change. So I have a little bit of a soft spot for dementia residents. That's kind of where my heart goes.
The statistics say in Australia, 1 in 5 people over 65 diagnosed with Alzheimer. The ratio increased to 1 in 4 when there is to 85. So it's a high ratio as we're having it. It's a major issue in our society.
Dementia is made up of like over 100 types. I think it's important to acknowledge that perhaps although 2 people have the same diagnosis, the same dementia, the same pathophysiology going on in their brain, symptoms for those 2 different people can be vastly different.
The way we can support people with dementia, we could support them either emotionally or practically. Emotionally, you just listen to them, you have a calm tone of voice, you don't correct them, validate their emotions. They may be confused, the memory may be confused, but their emotions are very valid and they feel as if they're very real. So you validate their emotions, you reassure them. A gentle touch, you can set up a structure, a routine in their life. You can make drawings that reminds them of stuff, pictures of the family.
You got to kind of divert around the problem and go, okay, well, they're saying they don't want to get out of bed, but there's usually an underlying issue. And you really got to work and like find what that underlying issue is. And sometimes it's just diverting. Like they could be yelling at you, telling you like, you're horrible and like, I'm going to hit you. Or they could just, fling a hand at you when you're not ready. So I think it's just diverting and like, okay, like you're feeling this, but have you had breakfast today? Or like, have you seen, it's such a beautiful day outside today. Something so random that distracts them from the current problem. And you can like get up and walk with them and be like, come for a walk. I want to tell you about this crazy obscene thing that happened, and it really diverts them. And then in the mix of all of that, you got to really focus, I found, on like the sensory stimulation. Like, are the lights too bright or is it too dark? Is the background, like, is it too noisy? Is it too busy? Do they know what's happening for the day? And like a lot of reinforcement of like, this is what's happening for the day, or this is the task that we're doing. We're just going to do this. And a lot of reassurance, like, it's okay. And reminding them, I'm the nurse, or my name's Shanaya, and this is how I'm going to help you today. And a lot of people, especially with dementia, it's not just dementia. They have a lot of underlying conditions. A lot of them are coming from the war days. So there might be some PTSD there or from personal experiences. So just reminding them like, you're safe. It's okay. I'm here to help you.
It's mostly a person-centered approach for that specific person, holistically looking for what we can to assist that person's for their daily life. One thing I would always say, don't take their rights or their daily activities from their hand. Let them do it and assist them whenever they need that help.
I think, it's important just to be present and to reassure as well, because dementia can be very scary for that person. When they're disorientated or they're confused or they're not sure who you are or what's happening. Being gentle, having a smile on our faces, warmth, and being respectful of their decisions and treating them still as anyone would want to be treated. And then obviously at different stages people require different things.
I think one of the biggest thing is you got to not take everything they say to heart. It's so hard because sometimes they can say some really hurtful things, especially if you're a loved one, like who are you? I don't know you. You're not my son. You're not my daughter. Or I've had patients where they've mistaken their kids for their husband or their wife. It really hurts hearing that stuff, but you got to not take it to heart and just kind of not argue with them.
Caring for yourself when you're caring for a person with dementia. I have heard stories of people who need care, who have looked after their partners or their loved ones for years, and it's very emotionally draining. It can cause carers fatigue, burnout, and it's very important that you look after yourself. You can feel guilt once you feel like you've given up on them, but there are a lot of services who can look after them. Just like the residential facility I worked in, there were like tens of dementia clients that were living there, and they were living quite well. People were spending time with them, playing, painting, drawing. Sometimes they can look after these residents better than you can at home. Of course, if you want to, you can, completely all right. But just being aware of the fatigueness and the burnout.
Showing awareness of the disease is a fantastic point, but I think this is a start by putting things out on social media.
And I think the more education that we can do, the more we can advocate and talk about it, If we don't talk about it, then it becomes like it's not a problem. So the more we talk about it, we can say, hey, this is somewhere, an area that needs support.
I would love everyone to be able to learn about dementia, because after looking at, some of my family members who have dementia, going into shops, into supermarkets, and then perhaps doing, or saying things that are not normal, and people turning around and staring, and for, people out there in the community that don't know, it can be scary.
It's just so prominent, and there's still people living out in their homes that have it or are showing early signs.
Social recognition, I would say. The more people know the signs and symptoms and what to do, the better, and just learn.
Everyone should know what to do and just understand what it is.
The more we talk about it and the more we have support for it, the better. Like, the more we can help people and offer them support and continue to offer these interventions and not treat them like they're completely disabled and they don't know anything. It's the thing, so many people with dementia, they might not remember or know that they have it, or they might be in denial, but they still need the extra support, and they still need the validation of, you're fine. You can still do the things you want to do. And it's giving the people those options so that they can still have those experiences and have that support, like not reminding them all the time that you have dementia. You just forget, not treating them like they do. They are so smart and so switched on. They still know when they're being treated like a baby. Still including them in the regular activities and not making them feel strange, not making them feel like they're different, because they know, they can tell. And sometimes that might just be the underlying issue, is that they're being treated like they're broken or like they are different, and they're not. They're just human. They just need a little extra support and a little extra love, and that's it.